Hey, Jen, why not? How are y'all? It is in the middle of the week. Today's Tuesday. I'm actually in New Orleans right now at a conference for the Environmental Grantmakers Association. My other co-hosts couldn't join me because they have like real actual jobs. Jamira is somewhere in Philadelphia working with the mayor on his youth engagement programs, and Daniel is on a bus headed back to New York from DC. But today, so I wanted to talk about healthcare. Affordable Care Act is something that is hot right now in the news, and particularly a lot of millennials. We think that we're this like healthy generation. I'm 21 years old. I remember telling my mom, having this conversation with my mom a few months ago actually, and telling her like I don't need healthcare. Like I don't need to pay for that. I'm healthy. But so I want to have this conversation about the Affordable Care Act, and I have Emet Tauber, that is originally from New York and is living in Philly right now. I want Emmett to talk. Emmett is from Organizing for Action, which is, so OFA used to be Obama for America, but now, so after the election, after Obama won for the second time, they transitioned into an organization that is fighting for the policies that Americans voted for when they elected President Obama. So let's talk about the Affordable Care Act. How are you, Emmett?
I'm great. How are you?
I'm good. So I'll let you take it. First I want you to like stress is healthcare important for young people? How old are
Healthcare.
you?
I'm 19, and
19.
yeah, healthcare is really important for young people because you never know when something's gonna happen. You don't know if you might get sick, you might get hurt, you might get injured, and suddenly you have no health insurance, and you're racking up all this money in healthcare bills, and that's in addition to all the student debt that you might have, and you're just drowning in so much money. That's why um, it's really important to have health care. With the Affordable Care Act, now you can stay on your parents' health insurance until you're 26. So you don't have to pay for it directly. If your parents have health insurance, you can stay on their health insurance. Another really cool thing is now that there is no copay for preventative care. So if you go into the doctor for just like a checkup, I know like if you're in college, a lot of colleges and even workplaces, they require you to have a physical once a year. If you go in there for that physical, it's completely free. So there's no downside in having health care. There's no reason why you shouldn't be covered because it's so easy.
It's easy and it's now affordable. So what are some of the ways that they can, if you have a young person that wants to sign up or look at those different rates, even if they aren't 25 or 20, is it 26 years old?
It's 26.
26, okay, 25?
26.
26. I'm obviously a little incompetent. So even if they aren't 26 years old, how do you go and sign up? Where do you go and sign up? I hear that it's pretty easy now.
Yeah,
It's like
okay.
as easy as like buying shoes online.
Exactly. So there's healthcare.gov, which is the official site for signing up for the Affordable Care Act. And basically, it's kind of like Amazon.com. They give you all these different prices. You fill out a few information about yourself, like how much money you make, where you live, that kind of stuff. And then they give you all these different options, and you can compare side by side different healthcare providers and what they offer. And it's really nice because you don't have to go in to do anything. There's nothing to figure out. There's not a whole bunch of math that you have to do. It's all right there in front of you.
That's super important because millennials, we like our things fast, quick, and fast, easy, and quick. So one of the questions I wanted to ask, we have this. It seems like there's still this debate about healthcare, and I think there's like a hurricane that's building up behind me. It's actually raining, and I'm a LA girl at heart, and I'm like melting right now, but trying to not act like I'm melting. Um, so one of my best friends, I'm gonna put her name out there. Her name is Genesis Godoy. She tweeted on Twitter. I didn't respond or talk to her about it yet, but I just saw on Twitter. She tweeted that with the Affordable Care Act now, in law, and now people are able to sign up for it. She says that this is like the doom, like America is going down because of the Affordable Care Act. I want to talk to you. So why is it important for us now to allow people that weren't privileged before to buy health care?
It's really important for young people to get care, and even people in general, because healthcare is so much of our debt. Like, people don't realize our collective debt, about half of that is from medical bills, because in recent years it's gotten so much more expensive to be healthy, especially because a lot of people, not necessarily young people, but just people in general, have chronic conditions where they're going to the doctor constantly, they're going to the hospital constantly. One hospital visit can cost you up to $10,000. I mean, that's a lot of money that you might not be able to pay back. So when you have health insurance, it's really great because you don't have to pay for all of that. And now there's no lifetime cap, so you can never be like kicked off of your insurance because you've spent too much money.
Nice. So you are an OFA fellow, right?
Yeah.
So how can other young people get involved with OFA?
OFA has about 50 some chapters in Pennsylvania. I don't know how many there are across the country, but there are a lot. And each chapter does different things. Right now, the Affordable Care Act is one of our most important issues, but you can also get involved in gun violence prevention, in immigration reform, in women's issues. There's so many different ways you can get involved. There's probably one in your county if you just look it up, and it's real. You can do anything from like working there, like I do, to just like help plan an event, or even just go to an event, or go to a phone bank and help call people. That's what I do a lot. I call people to remind them that, you know, the exchanges are open and they should go get some like healthcare. But yeah,
Nice. Just to end on, for some reason, just to end just to end this, and I want to ask a question. What do you think, as an OFA fellow, you're talking to people about the Affordable Care Act and what it will do for them and for different, like, personal people and communities? What do you think is the, like, one of the biggest struggles? What do you think will be one of the biggest struggles as this is law? A lot of people aren't educated on what that means for them. So do you think it's education? Do you think it's money?
Really is, I think it's really education, because people are so misinformed about what this law means. They think it's going to take away a lot of their rights. They think that they're going to have to shell out lots of money to, you know, get health care. They think that if they don't want health care, that they're going to like be locked up in jail. There's so many miscommunications about what the Affordable Care Act is, and it's really not even that like big of a deal. It's just a few simple steps to make getting healthcare easier. And I know there's a lot of controversy about the individual mandate, but because it's so easy to get healthcare now, there really shouldn't be a reason why you wouldn't get it, unless it's like an ideological thing, where then that's your fault because you didn't want it. So
Exactly. All right. Thank you so much, Emmett. We got to get you on some other GenYNot programming.
Yes,
maybe that would be cool. Maybe become a GenYNot correspondent. I got to get out of the rain, and I'm gonna let you go back to what you're doing on a Tuesday.
I got class in like an hour.
What class do you have?
I have writing and communications.
Nice. I should be in class right now, but I'm not in class. So go to class, go to school, do it the right way. Thank you so much for coming on. And we'll provide more information on thegenynot.com if you want more information on the Affordable Care Act and what that means for you. Thank you so much, Emmett.
Thank you.